Hello students, myself Sivaranjani, Assistant Professor, Department of Cardiac Technology, School of Allied Health Sciences, Salem, Vinayaga Mission Research Foundation, deemed to be University, Salem. So today our topic is Basics of Electrocardiogram. In this topic, we will see what is the basics of electrocardiogram. So firstly, electrocardiogram we are splitting into three, that is electro, cardio and gram. Okay, so electro means electricity, cardio means heart and gram means record. Thus, recording of electrical activities of the heart becomes the electrocardiogram. Okay, so electrical activity is the prior to the mechanical activity, that is the circulation we call, and it is the sum electrical activity of all cardiac muscle fibers recorded from the surface of the body. This implies in the surface of the body, on the surface of the body we will record the ECG. So electrocardiography, okay, next is electrocardiography. So electrocardiography is the process of producing an electrocardiogram. Okay, so the electrical current will be picked up from the surface of the body by using a suitable electrodes. So the father of ECG is Einthoven William, who is a Dutch physiologist who is considered as the father of ECG. So next is electrocardiograph. So what is electrocardiograph? It is an instrument by which electrical activities of the heart is recorded. Till now we have seen what is electrocardiography, what is electrocardiogram and electrocardiograph. So electrocardiogram is the electrical activity of the heart and electrocardiography is the process by which ECG is recorded, and next electrocardiograph is the instrument which is used to record the ECG. It's clear? So this is an ECG machine. You can see back button, power supply and paper recording everything. So next, the uses of ECG. Why we are using ECG? For recording and determining, diagnosing the heart rate, heart rhythm, abnormal electrical conduction, poor blood flow to the heart muscle, heart attack, coronary artery disease, hypertrophy of the heart chambers. For these all, we are using ECG for determining and diagnosing these all conditions of the heart. So next is electrocardiographic grid, that is the paper, electrocardiogram paper. Okay, so electrocardiographic grid refers to a marking on ECG paper. ECG paper has horizontal and vertical lines at regular intervals of 1 mm. Every fifth line is thickened. This is the duration and amplitude of the ECG paper. We are categorizing into small and large boxes. Here you can see a large box is comprises of 5 small boxes in vertically and horizontally. Totally 25 small box comprises of large box. So here you can see the time duration of different ECG waves is plotted horizontally, and 1 mm of 0.04 seconds and 5 mm 0.2 seconds. That means the speed of one small box, okay, the speed of one small box is in duration 0.04 seconds and in amplitude 0.1 millivolt, and its height and width is 1 mm. Here in large box, the duration for speed of large box in duration is 0.20 seconds and its amplitude 0.5 millivolt and its height is 5 mm. So the speed of the paper. Movement of paper through the machine can be adjusted by the two speeds is 25 mm per second and 50 mm per second. Okay, so usually speed of the paper during recording is fixed at 25 mm per second. If heart rate is very high, speed of the paper changes to 50 mm per second. So the speed of the paper is 25 mm per second and the duration of small box is 0.04 second, amplitude is 0.1 millivolt, duration of large box is 0.20 seconds, amplitude is 0.5 seconds and the speed of the paper is 25 mm per second. So next, how will you calculate the heart rate through ECG? So here we are calculating the heart rate through large boxes and small boxes. Here in large box, heart rate is equals to 300 divided by number of RR interval. That means the number of large box, between RR interval. This gives us heart rate through large box, and next is through small box, that is heart rate is equals to 1500 divided by RR interval. That means the small box between the RR interval. So next, through electrodes only we are diagnosing and determining the ECG or else the electrical activities of the heart. So we are now discussing about the electrodes. So ECG is recorded by placing series of electrodes on the surface of the body is called ECG leads. Okay. ECG is recorded in 12 leads. Electrodes are fixed on the limbs, usually right arm, left arm and left leg are chosen. Right leg is considered as ground electrode. So usually we are using 12 leads to determining the ECG. So Enthoven triangle. Enthoven triangle plays a major role in determining the ECG. How we will discuss. Enthoven triangle is defined as an equilateral triangle that is used as a model of standard limb used to record the electrocardiogram. ECG is recorded in 12 leads which are generally classified into two categories. Okay, so electrodes are categorized in two categories, that is bipolar leads and unipolar leads. This is the Enthoven triangle. Okay, so in bipolar leads are otherwise known as, it's also known as standard limb leads. One electrode is positive and another one is negative. As its name implies bipolar, each lead has two electrodes, that is positive and negative. Standard limb leads are three types: limb lead 1, limb lead 2 and limb lead 3. Lead 1 is obtained by connecting right arm and left arm. Here you can see bipolar leads. These are bipolar leads. This negative, negative, positive, negative and positive, positive. These three are bipolar leads. From this we can receive lead 1, lead 2 and lead 3. This is placed in right arm and this is right arm, left arm and left leg. So electrodes that passes from right arm to left arm gives lead 1, from right arm to left leg lead 2, from left arm to left leg gives lead 3. So this one, lead 1 is obtained by connecting right arm and left arm to the negative terminal and left arm to the positive terminal. Lead 2, it is obtained by connecting right arm and left leg, right arm to negative terminal and left leg to positive terminal. Lead 3, it is obtained by connecting left arm and left leg, left arm to negative terminal and left leg to positive terminal. So next is unipolar leads. The lead of the electrocardiograph in which one electrode is placed on the one of the limbs while the other is placed at an area of zero potential. So unipolar leads are mainly two types: unipolar limb leads and unipolar chest leads. So unipolar limb leads are called augmented limb leads or augmented voltage leads. Unipolar limb leads are of three types: AVR lead, AVL lead and AVF lead. So activated electrode from right arm in different electrode by connecting left arm and left leg is AVR. So as we have seen in Enthoven triangles, in right side of the arm is placed AVR lead. So next is AVL, which is placed on the left arm. So that is active electrode from left arm in different electrode from right arm and left leg. So next is AVF lead, which is placed on left side leg. So active electrode from the left leg in different electrode from two upper limbs. So AVR focus the right side of the heart. Okay, here you can see AVR focuses the right side of the heart, AVF focuses the inferior region of the heart and AVL focuses left and lateral of the heart. So next is unipolar chest leads. We have discussed bipolar leads and next unipolar leads. In unipolar leads there are two types, that is chest leads and limb leads. We have completed limb leads and now it is chest leads. So chest leads are called V leads or precordial leads. The position of the chest leads will be from V1 to V6. The 6 points indicates vector which shows the direction of current flow. Okay, so here is the placement. You can see all the chest leads placed on the chest region. So the position of each chest leads are V1 over 4th intercostal space near right sternal margin, V2 over 4th intercostal space near left sternal margin, V3 that is between V2 and V4, V4 over left 5th intercostal space on the mid clavicular line and V5 over left 5th intercostal space on the mid anterior axillary line and V6 over left fifth intercostal space on the mid axillary line. So these are the positions of each chestlates that are present over the chest. So color coding, there is a color coding for each one of the electrodes, including limb leads and chestlates. So AVR, color coding for AVR is red, AVL yellow, AVF green, and neutral that will be placed on the right leg is black. And V1 red, V2 yellow, V3 green, V4 brown, V5 black, and V6 violet. So these are the placement of all 6 chest leads. So now coming to the next segment of the topic is ECG waves. Till now we have discussed about what is ECG and its father of ECG, about the ECG paper and the leads, and now it comes about the ECG waves. So normal ECG consists of waves, complexes, intervals and segments. The waves of ECG recorded by limb lead 2 are considered as the typical waves. Normal electrocardiogram has the following waves, namely P, Q, R, S and T. So here you can see this a P wave, Q, R, S complex, and it is a T wave. Here you can see it is a PR interval and this is an ST segment. Later we will discuss it briefly. So first is P wave. So P wave is a positive wave. Okay. So here you can see it is an isoelectric line. This middle one is isoelectric line. Upper of the isoelectric line is positive, beneath of the isoelectric line is negative. Okay. So here you can see this P wave has a positive deflection from the isoelectric line. So P wave is a positive wave and the first wave in ECG. It is also called atrial complex. P wave is produced due to the depolarization of atrial musculature. Depolarization spreads from SA node to all parts of atrial musculature. Normal duration of P wave is 0.1 second. It is very important, the duration and amplitude of each and every wave. So the normal duration of P wave is 0.1 second and normal amplitude of P wave is 0.1 to 0.12 millivolt. So here is the P wave. So you can see when SA node gives impulse, so that time the atrial get contract or depolarization. During the depolarization of atriums, P wave are produced. So atrial depolarization initiated by the SA node causes the P wave. Okay. So next is QRS complex. So QRS complex is also called the initial ventricular complex. Q wave is small negative wave. So here you can see it's a Q wave, a small negative wave, and it is a tall R wave which is a positive deflection, and it is again a negative deflection which is a S wave. So Q wave is a small negative wave. It is continued as a tall R wave which is a positive wave. R wave is followed by a small negative wave, that is S wave. So again QRS is a complex. We will discuss why Q wave and R wave and S wave are producing likewise P wave. So Q wave is due to the depolarization of basal portion of the interventricular septum. Okay. So when the basal portion of the interventricular septum depolarizes, Q wave will be formed. R wave is due to the depolarization of apical portion of interventricular septum and apical portion of ventricular muscle. Okay. So S wave is due to the depolarization of basal portion of ventricular muscle near the atrioventricular ring. So here in this slide we have discussed how Q wave are formed, how R wave are formed, and how S wave are formed. So next, the duration and amplitude of each waves. Normal duration of QRS complex is between 0.08 and 0.12 seconds. As QRS complex combinedly give the depolarization of ventricle, the duration will be combining only. But amplitude is different for each wave, that is Q wave 0.1 to 0.2 millivolt, R wave 1 millivolt, and S wave 0.4 millivolt. Okay. So here you can see the depolarization of ventricle which gives QRS complex, right. So next one is last wave, that is T wave. Okay. So T wave is the final ventricular complex and is a positive wave. T wave is due to the repolarization of ventricular musculature. Okay, so the depolarization of ventricular musculature is QRS complex and the repolarization of ventricular musculature is T wave. So its duration is 0.2 seconds and its amplitude is 0.3 millivolt. Clear? So U wave, basically U wave are very rare. Okay. So U wave is not always seen, it is also an insignificant wave in ECG. It is supposed to be due to repolarization of papillary muscle. When the signals from papillary muscles, okay, when the signals from that is traveling from SA node to papillary muscles, when this delays from papillary muscle to papillary muscles, that is Purkinje fiber, okay, when the branches of Purkinje fibers receive signals in delay manner, then we can find U wave in ECG wave. So it is very rare, in some of the cases we can see. So here you can see picturized pattern of each wave. Depolarization of atrial gives P wave, and next depolarization of ventricles gives QRS complex, and the repolarization of ventricles gives T wave. Here is a summarized of all waves, that is P wave, QRS complex and T wave. So next is intervals and segments in ECG. As we have discussed on the previous slide, there is PR interval, PR segment and ST segment, and then QT interval. There are two intervals and two segments. Now what is PR interval and segments? So PR interval is the time interval between the onset of P wave, okay, between the onset of P wave and onset of Q wave. The normal duration of PR interval is 0.18 second and varies between 0.12 and 0.2 seconds. So if it is more than 0.2 second, it signifies the delay occurs in the AV node. So it is called AV nodal delay. Okay, when it is a delay, it mainly due to AV node. Thus the delay, the abnormality due to AV nodal delay is known as AV nodal delay. Okay, so PR segment is equals to AV nodal delay. So if there is an abnormalities in this PR interval, this indicates a delay in AV nodal pathway. So next is QT interval. QT interval is the interval between the onset of Q wave and the end of T wave. Here you can see onset of Q wave until the end of T wave. This is known as the QT interval. QT interval indicates the ventricular depolarization and ventricular repolarization. It is a combination of ventricular depolarization and repolarization. So whole electrical activity of the ventricles lies between QT interval. So normal duration of QT interval is 0.4 and 0.42 seconds. So next one is ST segment. So ST segment is the time interval between the end of S wave and the onset of T wave. So here you can see the end of S wave. Here is a green mark from the end of S wave to starting or onset of the T wave. This is known as ST segment. It is an isoelectric period. The point where ST segment starts is called J point, that is this point. Okay. So where the ST segments join, this is known as J point, that is junctional point. It is the junction between the QRS complex and ST segment. Normal duration of ST segment is 0.08 second and ST segment is very much important in myocardial infarction. It plays a very major role or vital role in myocardial infarction, in both myocardial infarction and ischemia. So due to its elevation and depression upon the isoelectric line, it gives infarction and ischemia. So next is RR interval. The RR interval is the time interval between two consecutive R waves. That is, complete wave is from P wave to T wave. So R wave from one complete wave to the distance between R wave, both R wave from one complete wave to another complete wave is gives RR interval. So RR interval signifies the duration of one cardiac cycle. So normal duration of RR interval is 0.8 second. So here with this RR interval we are completing our topic, today's topic, that is the basics of ECG. So still what we have discussed is what is electrocardiogram, that is an electrical activity of the heart, electrocardiography, which is the process of recording the electrocardiogram, and next electrocardiograph, which is an instrument. Okay, so electrocardiographic grid refers to the markings, movement of the paper through the machine, that is speed of the paper. The speed of the paper is 25 mm per second. So we have small boxes and large boxes. Small boxes of 1 mm and large boxes of 5 mm. So 5 small boxes comprises of 1 large boxes. Then we have discussed about the electrodes. Electrodes are connected in left arm, right arm and left leg through intervention triangles we have discussed. Right leg is called the ground electrode. So in electrodes we have 2 types, bipolar and unipolar leads. So bipolar leads we have lead 1, lead 2 and lead 3. Unipolar leads, again it is classified into 2, that is limb lead and chest leads. So limb leads we have AVR, AVF, AVL. So limb leads is also known as augmented leads. And next is chest leads. Chest leads is also known as V leads or precordial leads, that is V1 to V6. So totally we have 12 leads, so it is an 12 lead system. So next we have discussed about the waves, different waves in ECG waves, that is P wave, QRS complex and T wave. So P wave is the atrial depolarization, it implies the atrial depolarization, and next QRS complex indicates the depolarization of ventricular musculature, and next is T wave indicates the repolarization of ventricular musculature. And next is segments. We have discussed about the 2 segments and 3 intervals. So first is PT segments, that is AV nodal delay, and next is ST segment, that is isoelectric line with the J point, which is very important for myocardial infraction and ischemia. Then next is PR interval, that is conduction to AV nodal. Then next is QT interval, that represent the ventricular depolarization or whole ventricular depolarization, whole cycle of ventricles through QT interval. And next is RR interval, that is 1 cardiac cycle. And the cardiac vectors are electrical activity moves from negative to positive. From negative to positive the cardiac vector travels, and the mean vector lead 1, lead 2 and lead 3. So thank you for watching my class.